So if we're having trouble progressing some of our cervical motion, especially we're getting into some of the retraction, extension progressions, things like that, we're getting a little too much down the arm, feel it might be the right motion to do, but we got some space and kind of tension issues that might be throwing that off. We can harness some of the effect of what we call the shoulder abduction or Bakody sign effect when we take tension off the neural tract to see if that chills out some of the symptoms. Some of this might even be built in when we do some of our initial cervical retraction extension. We're getting that little push here. We're getting a little bit of slack on a certain section of the brachial plexus go up into the nerve, so we can even expand on that. Go like shoulders up into here, almost hands getting up over top. So when we breathe out, get over top and get a little further back up and up. So we can almost start from the elbow, start from the thoracic, get that lift, a little head back and up. We get a better response out of that. Part of it is the upper body and the shoulder blade getting the upper thoracic to get a little more involved, maybe clear some extra motion to help out the neck. But we also have a factor where we're changing some of the tension going across the brachial plexus. So if we take a little bit of tension off the nerve, we get a little extra wiggle room in there to get into the joint where we're trying to get our effect to make the nerve happy later. So just one of those variables to play with when we're adding into it. This is almost similar to adding hip flexion into extension, either extension in lying or extension in standing with back bends. If we're bending backwards and tensing femoral plexus, might have to take some tension off the hip to help that. Some other videos on that. So kind of along the same line. So hope that helps with some of the oddball cases, and have a good day.